Have you ever wondered how pregnancy can be prevented or how it can be achieved naturally without using what we call artificials like hormonals or IUCD? In today's video, we are going to talk about it. That is crucial topic called natural family planning. Here we go. We are going to discuss about the meaning of family planning, the methods, and the way it can be achieved effectively. So, let's get started. Family planning naturally is the way which somebody can achieve or avoid pregnancy. When I mean natural family planning, we are not going to use hormonals. We are not going to use anything artificial. It's just natural. And we have some methods. There's one called calendar methods. Calendar methods is there. Then monitoring of your cycle, the menstrual cycle. Another one is basal body temperature, and that of using of cycle bead, and symptothermal, that is your basal temperature plus monitoring of the mucus. So we have to start. We will equally talk about advantages and the limitations of using natural family planning. Natural family planning, when we talk about using calendar method, you just have to have a bold calendar, the calendar that can be easily readable. Using calendar, as your menses starts, you circle it with red marker. And with red marker, you'll be able to take another distance like blue marker. You see 1, 2, 3, 4, 5, 6. Some people increase their own to 7 days of menses. You leave it free. Then as from the 7th day till the 12th day, you have to use red marker to block those days, meaning that they are danger periods. Then after that, you will leave other days. That is free. Another one is using of basal body temperature. That one is being done when you wake up in the morning. Before you get up to do anything, that means you have to put your thermometer under your pillow and small book or paper which you can record whatever you are getting. So use your thermometer, check your temperature, you record on daily basis, if possible at the same time. So that when you notice there's a spike in your temperature, you know that you've started ovulating. That is the one for temperature. Then you can equally use what we call mucoid, that is the cervical mucus. You monitor it, how it's coming out, and that is to say each day you will equally check what is coming out from your cervix. At a time when you see that it's slimy like okra, and it's very light. Before that time, it used to be thick like pap. Another thing is the one we call the symptothermal method. That is combination of your body temperature, combination of the mucus coming out. Those are the methods you can use to see how your body is, because we are trying to monitor the body signs, and it's the body signs that will guide you on the stage which you are. Another method is what we call amenorrhea method. That of amenorrhea method is using breastfeeding to check your body or to control pregnancy, in which you see that you are breastfeeding, that is exclusively for at least 1 year. Some people, they breastfeed like 2 years and they will not get pregnant. But some people, doesn't really work for them. Another one is using of cycle bead, something like this. This bead is about 32 in number. If you look, you will see this one is red. This red one is the one that is the day your menses starts. And if you look, you will see this arrow pointing to this side. So the day you see your menses, after that, this ring, another day comes, you move it the first day after menses. After that, the second day you push it. When you check, you see that this brown one is 1, 2, 3, 4, 5, 6. So this first 6 is the safe period. After that, you will see this one, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. You this period, if you have your calendar, you can equally mark it. That is danger period. You don't go this way. But for somebody who wants to achieve pregnancy, that is the period you have to meet. But this one now, we are talking about preventing. So this period you don't meet. You can equally add another number, join, for safety. Then this period, you are free until the day your menses comes out again. This is the cycle bead. Yes, we have talked about the methods. We'll now talk about the advantages of natural family planning. As you're watching, don't forget to like, comment, and subscribe. You share equally. So let's go to the advantages. When you talk of advantages, that's the benefits of natural family planning. It doesn't involve any interference of your body because it's just natural. No hormonals, no injection, no implants, nothing. And equally brings openness between the two partners. Your husband will equally ask, Angie, I hope you are watching the calendar. He say yes. That is openness and communication. It creates bonding. Because the one you did not remember, your wife, if it's this bead, as you move it, you just hang it where two of you can be seeing it. Your mind is seeing it, you are seeing it, your brain is accepting that this period is no go area. So you caution yourself that we are not going to meet. Another thing is it is environmentally friendly. What I mean by environmental friendly is you are not looking for way to dispose, like condom. Some people will use, put it in the toilets, and it's not friendly to the toilets. Injections, you use syringes, you are disposing it anyhow. Implant, after which to dispose. So it's environmentally friendly. It is equally flexible. What I mean by flexibility is you can decide to stop or to change, or to stop or to go ahead. So when you look at it, you see that by the time you want to achieve pregnancy, you're on it. But by the time you want to stop, you equally diverse. So it is flexible. And there are many limitations as well. Not so much, because whatever that has advantage in most cases or equally have disadvantage. Some people may not be able to read the thermometer very well. And some people may miscalculate. And when they miscalculate, it becomes a problem and the person may equally get pregnant. is less effective for those that have irregular menses, especially like using this. Some people have 28 days menstrual period, while this thing is about 32 in number. So when when we talk about using this bead to check, it is not friendly for those that has irregular menses. And another thing, it will require you to get somebody or a provider that will guide you properly on how to use them. If you don't, it becomes problem. So effectively, it requires discipline, because when you are not supposed to meet, you have checked the calendar, you have checked if you are using the bead or your body temperature, and your man comes, he cannot hold himself, or the other way around, it requires high level of discipline, and it can become an issue when there is a quarrel. You know, have you heard that some people likes or they uses quarrel to settle? So the woman or the man may just think otherwise. So it equally needs two of you to agree. Do we really agree to go on or not? And another limitation, it's at times it may be very difficult for two of you to choose a method. Is it the body temperature own we are going to use, or is it the calendar, or is it the mucus own? So when you look at it, you see that it's not still all that easy to make up your mind on a particular method you want to use. And as well, using it does not prevent you from getting infected. It does not. So you really have to be very, very careful when you are using it. You equally need to educate yourself. Educating yourself, which one will I take? The husband will say, Angie, which one do you want us to take? So that one too may cause misunderstanding among the couples. It also needs consistency. Consistency that every day you wake up, you must check your temperature. When you really look at it, it's not easy, but it has to be done for you to get it right. Tracking your cycle. You need to track your cycle severally before you now say yes, like somebody who is using a temperature. You not just do it 1 month, you say that's all. You have to do it like 2-3 months to be sure, say yes. Or this symptothermal method that you have to use both cervical mucus that is coming out, use your body temperature and the changes you feel in your body when you want to ovulate. So it is usually advisable to make sure that both partners are able to agree on the one they want to use so that it will work out effectively. Another advantage is it helps the woman to own her health knowledge or her fertility period, or yes, the fertility period on her own by monitoring, of which if he doesn't take any method, he may not really know what is happening. Some people, when they're ovulating, their body will be a bit warm. Some people will have some pains at the flank here. So there are different ways somebody can feel can feel her own body changes. And if you don't do it for some months, you will not really be able to get it right. But that of using calendar is something that each month, if you know your cycle, like when you see your cycle, you mark it the first 6 days. Instead of you taking the normal 6 days, you can now add 7, 8 to be on a safe side. so that you will prolong your own period that is called safe. You add another 2 days, add it to the unsafe one. Then the unsafe one that is about 12 days, you add another 2 days to make sure that yes, I'm running away from danger. And as you do this, definitely you will see that you are, or you'll be able to achieve it right.